It's Memorial Day weekend. Can't believe it's here. The weather is nice. Is it now okay to let maybe our kids see their friends or that extended family?
Yeah, it's obviously going to be a great chance for people to really want to be getting together. I think people should certainly be keeping in mind that while cases in Massachusetts have been decreasing, that probably is largely due to the social distancing and the stay-at-home orders that have still been in place. So while restrictions are loosening up somewhat, it in any of these phases will take a couple of weeks to really understand what the loosening of restrictions is having in terms of an effect. So I think people should still practice a few very safe rules. Outside visits are better than inside visits. No large gatherings. Your exposures are cumulative, so the more people you're with, the higher the risk of exposure. And maintaining social distancing would still be really important in any of those scenarios.
Okay, things to keep in mind.
Yeah.
Let's shift gears a little bit. Has Massachusetts seen any more cases of that illness? It's similar to Kawasaki disease in some younger children who are contracting COVID. And remind us of the symptoms.
Sure. So we are seeing some more cases. I would say, though, that the numbers are still low. This is still a relatively rare condition. We tend to see these cases in school-age children and teenagers, which is a little different than what we traditionally think of with Kawasaki disease, which in and of itself is also rare but tends to affect younger children. The symptoms to be on the lookout for are fever, particularly lasting more than a day, more like 2 to 3 days of fever, but fever that happens in association with a rash, with redness of the eyes, redness of the mouth, swelling of the hands or feet, or associated abdominal pain with diarrhea or vomiting. Any of those symptoms should be discussed urgently with your doctor.
Okay. We also saw some reports about doctors in New York and a few other places seeing an increase in these symptoms in teenagers and young adults, which is something we hadn't seen before. Are you seeing that as well, or have you heard about this?
We have heard about it. It's conceivable that young adults may not present to a children's hospital, but there have been case reports from other providers and other hospitals that they are seeing this multi-system inflammatory syndrome in young adults, so in individuals in their 20s. So it would be very important, not just for patients and families of children that are either teenage years or school-aged years, to be aware of these symptoms more broadly and to discuss any concerning symptoms with their doctor.
Always the best advice. Call your doctor if you have questions. All right, Dr. Moffitt, thank you so much for your time. We appreciate it as always.
Thanks for having me. Yeah, thank you.